Okay, the blood test that we mentioning to measure the kidney functions include blood tests, urinary dipsticks, and other kind of exams as radiography, X-ray, ultrasound, and other echosonography and other kind of tests to measure and to assess any kind of alteration or disorder of the kidneys. Here we have a typical question item that appear on the exam, HES exam and ATI exam. Glomerular filtration rate, serum creatinine, creatinine clearance, bond, and the most frequent item that appear on the blood test, and also on the dipstick that appear leukocyte, hematite blood cells inside the urine, protein, glucose in the urine, and nitrogen and other kind of iron in the that appear in urine. So on the blood test can appear on the exam the estimated glomerular filtration rate, that is the process that the urine, how the urine is filtrated through our kidneys tubules, the different tubules, normally is the 60 or 90 to 120 per minute. Is considered kidney disease when it's between less than 60 but more than 15. So serum creatinine is a Western producto de desecho, serum creatinine, and normally is 1.2 milligram per deciliter in women and 1.4 milligram per deciliter in males. Creatinine clearance, there is a way to assess or to measure the creatinine clearance that in elder people has notably decreased. They use another kind of adjective as a notably, considerably decrease the creatinine clearance. That is the process when the creatinine, that is a Western product, is filtered on clearance or removed from our blood. Remember, clearance from the store, from Macy, from JCPenney, the clearance is when they want to remove any clothes because the chain of systems is similar this concept in our body. So when the creatinine clearance is 80 to 135, it's normally the creatinine clearance in elder people. But remember that aging changes in elder people include decrease of function of the kidneys, and one of that is decreased is the creatinine clearance. But the creatinine, serum creatinine is increased. But the process of removal, the creatinine clearance, is decreased. So our kidneys in elder people decrease the process of removal of creatinine. What is bond? Bond is the blood, urea, and nitrogen that is due to the, it's a Western product that is also way, in a specific way to measure the function of the kidney. What is the more specific way to measure the function of the kidneys, creatinine clearance, and estimate glomerular filtration rate? This is a frequent question, and you can get, this is important for medication because if the creatinine clearance is decreased, the process of removal of the wasting product of our body is decreased, thus the medication we should, there are a lot of contraindications to provide or to administer or to indicate some medication in other people or the kind of patient with kidney functions impairment. Continue with other kind of, now we're going to discuss one question that typically appears in the HEX exam, on the NCLEX exam, and other kind of exam for medicine and nursing.